Good morning, Facebook. I greet you in the precious name of our Lord Savior, Jesus Christ. I decided to take this route to get my message across. I am a registered nurse for the past 21 years. I am also a funeral director, a mortician, where I thoroughly enjoy both professions, but more so, my heart and soul is being a nurse because it was my first ever profession. Now, I was admitted to the hospital yesterday morning. I woke up and I was sweating profusely, and I just felt very dizzy, very giddy, and was falling down uncontrollably. Couldn't help myself, so I asked my mother to call the ambulance. The ambulance came quite quickly and they took me away. They did my blood pressure, it was very high. Anyways, they took me to the hospital, and after they wheeled me in and explained my situation, the nurse said to put me on the chair to sit down. They put me on the chair, but for some reason, not knowing what to expect under food poisoning, I kept bobbing from one side to the next. I just couldn't hold myself up. I didn't know my bearings. And I sat there. I remember sitting there for a few minutes. Anyway, the nurse came over. Nurse Harris, a Dominican. Very dry in demeanor. Never did introduce herself. Came over, took the blood pressure. The cough, after 3 attempts, keep coming off because obviously it's too small. And I looked up at her and I'm wondering, I wonder when she's going to find another means to take my blood pressure. Any which way, she continued. And after realizing that she couldn't get it, and complaining about the cough, and complaining that nothing is working in the hospital, I can't even recollect what she did after that. Any which way, I remember me fainting to one side and holding on to my mother. And long story short, when I caught myself, I was on the floor. I don't know if I had a blackout, if I fainted or what, but I was on the floor with my legs open. My period had just started, so, you know, can imagine my clothes up, my legs open, and I'm on the hospital floor. And I shake my head just in time, and I'm like, Mom, what happened? She said, you fell down. Looking across at the desk, the nurse is there standing at the desk looking over at me. So I heard my mother screaming, I can make my picnic dead. I can make my picnic dead. Me not understand what go on here. Y'all just standing there, nobody coming to help her, nobody coming to pick her up, nobody assisting her. What kind of nurses there be? They're calling for orderlies. Never did the nurse come to my side to even say, Ma'am, are you okay? She just stood there. After the orderlies came, they got me up, they put me in a bed. I was very cold and shivering and disgruntled, because I just couldn't understand me coming in ill and have to go through this. And I'm a fellow nurse, nevertheless. And I asked myself, if you can do that to your own nursing fraternity, whether you know me or not, what would you have done to a sister that have trained you? Or what would you have done to... Nevertheless, I guess the Prime Minister had to come in to get some sort of special treatment. Any which way, I stayed on the bed, and the nurse came. I have an injection for you. I'm like, excuse me? An injection for me? You didn't even tell me your name. Nevertheless, tell me what kind of injection you're giving me. Are you giving me injection? So I basically just pushed her hand away. She stormed and she said, oh, you slapped my hand, you slapped me. So my mother jumped in and my mother said, she didn't slap you, you're a liar. She just basically push your hand away because she don't want no medication. She don't want it because you don't say what it is. How you going to give it to her? Anyway, she stormed off and she stormed off to her desk. And she went back. Same time, I said, you know what? Take me to Dr. Marcus. Take me to the private doctor. Because at least when you pay your money, they must give you good service. Same time, Sister Jarvis, one of my apprentices from way back when, years ago, wonderful sister, expertise in emergency care nursing. She came and she said, Gilead, and she said, you know what, calm down. I will take care of you. Sister Jarvis put up my IV. She brought medication for me. She gave me a blanket. She did proper nursing care to me. Anyway, the shift continued. Of course, the nurse passed and she ignored me all day. And usually, in the emergency room, if you've ever had the experience, you will know. One nurse go to the desk and report to the other nurses. Most of them do come back with an attitude, yeah? Because you're a troublemaker, yeah? Not saying that I am a nurse and we take an oath. We take an oath to be sympathetic, be understanding, be empathetic. Treat every single person that comes through us as your mother, your father, your sister, your brother. We must treat them as family members, because when the family members come in, they rush, headless chicken, here, there, and everywhere. Helping, help my mother, help my mother. I want the best care for my mother. But what about everybody else's mother? Everybody else's sister? Everybody else's brother and father? Okay. Any which way, so the nurse, I'm there lying down, and I got really, listen, I got so emotional, I started to cry. And I said, I can't believe what my profession has come to. I can't believe it. Then again, I'll speak on that. Let me tell you about my experience. Anyway, so the nurse now, she's dealing with another patient beside me. And there was a gentleman on the bed on the other side. Everybody now like to mind people's business, especially if it's injustice. Right? The gentleman on the other bed, apparently he's in for blood clot. Now, he keeps walking back and forth, and I'm watching him, and I'm saying, oh my, he really doesn't have the education to know that, sir, you just really need to rest and put your foot up. I hear the same Nurse Harris, yeah, Dominican, bad mannerism, unprofessional. So I hear her tell the gentleman, you're not supposed to be standing up on your foot, you walk about. You're not. So I said to her, nurse, that is not how we speak to our patients. Knowing me no make hear that and have her deal with the man. So, sick or no sick, right is right. She said, the devil sent you for me. I said, trust me, when I get up off of this bed, the devil gonna find you. You hear me tell you? I gonna done you. I gonna tell Facebook what I tell her. Anyway, she say, well, tell the devil you gonna find me. When if you don't just mind your business. So I say, how unprofessional are you? How unprofessional? Is that a threat you're telling me that you're going to done me? I say, nurse, you're going to done yourself before me even done you. How unprofessional are you? You don't even know who you're talking to. Any which way she walks off and she cuss and she cuss and she cuss. I said to myself, long gone the days on a ward when I would have dear, cuss back a patient. You know Sister Dorset or Sister Warner would have done rag me up, discipline me, maybe even suspend me for even having such a conduct on the ward. Because when we go out there, we're supposed to be exemplary of the school of nursing and what we represent as nurse. You have to hold your mouth as a nurse now. Not that you must take abuse. But you must be careful what you say to the clients, and you must always, in everything, be courteous to your clients. Look, the nurse cussed and my mother sat there and my mother shake her head. And I said, Mom, boy, it's all right. And tears ran out of my eyes. Because I said to myself, listen, what nursing has come to, I don't know where the problem is starting. Me not if for the School of Nursing, because the same School of Nursing that put out these students are the same School of Nursing that put me out. You hear what I say? So I defend my School of Nursing, Antigua and Barbuda, the School of Nursing. But I don't know if they need to properly assess these students. I'll put them on probation for a year before they send them out with paperwork. I have no problem with foreign nurses, because you come to a country and you want a job, you get a job. Because if I go to another country and I want a job, I expect to get a job with my qualification. But some of these nurses have no respect, especially the foreign ones, for Antiguans, indigenous Antiguans who come in with issues. And because of that, there is a barrier to proper nursing care. There is a barrier to proper nursing care. What is the Mount St. John administration doing? What are they doing? What are the head nurses doing? The same head nurses that trained me and put me out and all supposed to get so much education, so much professionalism, and so much ways and means of dealing with disciplined students and nurses. Where are they? Where are they? You get 2 stripes and you stop work for nursing. You get pant up a certain level and you stop work for nursing. Are you a nurse or not? I ask myself. You understand me? Because if you're not heart and soul in the business, come out. Because more people are getting hurt with improper, unprofessional nursing care than those who are in it to win it. A lot of people are getting hurt. We got to be careful how we treat people. You see me taking this to the media? This is no joke. This is no joke. I felt so embarrassed. I feel like my minga dead behind a screen with no nurse. Where are the nurses? Where are the proper nurses? If you don't rein them in from now, we're going to put out a breed of nurses that just don't care about people, who just wants to be in the prissy white. You understand me? And want to get paid. Where are those nurses? Where are those nurses that improvise? Even though you don't have everything to work with, you improvise and you get the work done. With clean heart, spirit, and soul. Where are those nurses? I asked myself this question for the whole night in the emergency room laying down there. You see nurses who are supposed to know better, who don't do better. Where are these nurses? When I speak of nursing, you understand me? And I put myself out there as a nurse. Anybody who knew me from Halberton, still up to today, call me nurse and say, point the finger and say that was a good nurse. You know why? Because Sister Warner made me a good nurse. Trained me into a good nurse. Sister Dorset, Sister Bennett, my preceptors, Sister Jarvis, Sister Frederick. You don't even know these nurses. Sister Hector. You understand me? Sister Morrissey. You lose respect for all these nurses. You understand what all they stand for. And so many to mention. Sister Williams, Sister Smith. How you think I love anatomy so? Sister Smith drilled that in me. And still you have to be putting up with this. I mean, if it's not your family member, they don't be putting out themselves. To the doctors now. These people like you begging them for service. Like you begging them for service. Can't be bothered. Whatever the nurses go to the desk and say, they just go off of that. So they come to you, not with an open mind and heart and soul, but they come to you with an attitude. I'm not even worried about the doctors. You hear me tell you? Because jump high, jump low, I don't care who doctor you be. You see these 2 eyes of a good nurse? These are who makes you a good doctor. Because if we don't observe, and if we don't tell you about the patient, you have no idea who you're dealing with. All right? So I'm not even going there with the doctors. I'm not even worried about them and their qualification, MBS, QBC, whatever. I'm not even worried about doctors. I'm not even going to take up that topic. But let me tell you, I'm to the point where we need to draw back. We need to draw back. This is not to accuse nobody. This is to talk about my experience. We need to draw back as nurses. we either going to give good care or we're going to get out the profession, because you're killing it. You understand me? And the School of Nursing need to run and really look at the nurses that we're putting out. Is either you're in it or you're not in it. Don't just put out nurses to say you have X amount of nurses per year. Sometimes you got to rein back and stop take nurses and revitalize, go back, take those old ones back into classroom. You need to have some professionalism board. You understand? Pull them up on professional behavior. Listen to people from the outside. Listen to their complaints. I wonder why they complain about that same nurse so many times. Don't turn a blind eye. This is our medical system. This is our nursing career. This is our medical life, our country. This is us. We're Antiguans. I love nursing. Ain't nobody gonna stop me from loving nursing. But my first love is loving people. And if you don't love people, then what type of nurse are you? Worst off, if you don't love yourself, what type of nurse are you? This is very emotional for me, because it is an esteemed position in society. And some of these nurses just too braggadang for my profession. Look at the uniforms. Look at the uniforms. What are you telling me? The head don't see that the skirt is too tight? The head don't see that the dresses are too tight? The head don't see that the skirts are too short? They say I'm a troublemaker every time I come to the hospital. I'm not a troublemaker. I'm just a nurse that has a passion for my profession and know how I expect to be treated from all nurses, whether here or there, young or old, experienced or inexperienced. I'm a nurse, and I know how a nurse is expected to behave, especially to your colleagues. Listen, Facebook, I'm not pointing fingers. I just want a wake-up call. And that one night in Mount St. John, gave me my wake-up call. These people need to do something about nursing care in Antigua. All right? Blessings, guidance, love, protection to all. Thank you. Thank you for listening. Have a wonderful day.